Welcome back to Drugs Decode. Today, we're focusing on sulfonylureas, a class of oral antidiabetic drugs commonly used to manage type 2 diabetes mellitus. We'll cover their mechanism of action, pharmacokinetics, clinical uses, adverse effects, and contraindications in detail. Let's dive right in. So, what are sulfonylureas? They are oral hypoglycemic agents primarily used to lower blood glucose levels in patients with type 2 diabetes. Unlike insulin injections, these pills stimulate your pancreas to release insulin. Examples include first-generation drugs like tolbutamide and chlorpropamide, which are less potent and require higher doses. Second-generation drugs like Gliclazide, glimepiride, and glipizide, which are more potent, require smaller doses, and have fewer side effects. Let's explore how sulfonylureas stimulate insulin secretion in pancreatic beta cells. The process begins with glucose entering the beta cell through GLUT2 transporters. Once inside the cell, glucose is metabolized through glycolysis and further processed in the mitochondria, leading to the production of ADP, our cell's energy currency. The rise in ADP levels inhibits ADP-sensitive potassium channels, also known as K-ATP channels. Sulfonylureas enhance this inhibition by binding to sulfonylurea receptors, which are part of the K-ATP channel complex. With potassium unable to leave the cell, the membrane potential shifts, causing the beta cell to depolarize. This depolarization triggers the opening of voltage-sensitive calcium channels, allowing calcium ions to flood into the cell. The influx of calcium signals the insulin-containing vesicles to fuse with the cell membrane. Insulin is then released into the bloodstream to regulate blood sugar levels. Let's look about pharmacokinetics. They are well absorbed from the GI tract, highly protein-bound to albumin, metabolized in the liver by CYP450 enzymes, excreted via the kidneys and, to a lesser extent, the bile. This is why caution is needed in patients with kidney or liver issues. Sulfonylureas are used to treat type 2 diabetes mellitus. They can be prescribed as monotherapy when diet and exercise aren't enough. In combination therapy with drugs like metformin or injectable insulin. Like all drugs, sulfonylureas have side effects. The most common is hypoglycemia, especially if you miss a meal or overdose. Other effects include weight gain. Increased insulin levels promote fat storage. Gastrointestinal issues. Nausea, vomiting, and bloating may occur. Hematological effects. Rare cases of leukopenia, thrombocytopenia, or hemolytic anemia. Hypokalemia. Excessive insulin release can lower potassium levels, which may require monitoring. Always monitor your blood glucose levels and watch for these symptoms. These drugs aren't suitable for everyone. Sulfonylureas are contraindicated in type 1 diabetes. Since there are no functional beta cells, sulfonylureas won't work. Severe kidney or liver disease. Impaired metabolism or excretion can lead to drug accumulation and hypoglycemia. Pregnancy and lactation. Insulin is safer in these cases. Ketoacidosis or diabetic coma. These are emergencies requiring immediate insulin therapy. Use with caution in the elderly, who are more prone to side effects like hypoglycemia. In summary, sulfonylureas are effective and affordable drugs for managing type 2 diabetes, but they require careful use to avoid side effects like hypoglycemia. If you found this video helpful, hit the like button, share it with your friends, and don't forget to subscribe to Drugs Decode for more pharmacology insights. See you next time.